Good evening, everyone, and welcome to our Tuesday Zoom lecture class. I'm glad I have some of my new students on, Jared, that you didn't get to meet. We have Shaquana, Ebony, Brianna. These are new students. Jared is not that old, but he's a seasoned student as of now. He's seasoned, so we're going to just go ahead and get started. So as I was saying, chapter 25, we're in the pathology section. I'm about to share my screen. So chapter 25 is pathology laboratory. So this is the chapter that you will be having your exam on. So it will open. I'll open it tonight. It's due for tomorrow, but you have until Sunday to complete this exam. So please remember to read your PowerPoint slides, read the chapter. This was a short chapter as well. So this is only a 20-day module. So 20 days goes by really, really fast. And then we're moving into the last chapter. I think we have 2 more chapters in this module, but it's only a 20-day module. So the classes are very short. We're only covering the most important part on what you would need to know when it comes time to that certification exam. But it's important for you to read your PowerPoint slides, read through your chapter. You have to be responsible and take that initiative to read through the chapter and read your PowerPoint slides. The exam opens tomorrow, but we have class on Thursday. And on Thursday, we will be reviewing on what will be on your exam. I'm going to do a few questions tonight on what it's going to be on your exam. But on Thursday, we will do a thorough review of what will be on your exam because you have until Sunday to complete it. So chapter 25 is the pathology laboratory section. Let me put on my glasses. So it says there are many acronyms used in the code descriptions for these codes, such as TDM. And remember, you have to become familiar with these acronyms, abbreviations, and terminology, because when the doctor is documenting in the medical chart, he's not going to put therapeutic drug monitoring. He's not going to put all of that. So you have to become familiar with the acronyms, abbreviations. So therapeutic drug monitoring is TDM. So that's usually what's going to be in that medical chart, TDM. And most times the nurses or other professionals, they're not going to write out that whole term. They're going to use abbreviations and acronyms. It says, if you don't know what the acronym means, look it up. Never pass a term, abbreviation, or acronym that you don't know without taking the time to do a bit of research and in turn expand your knowledge base. A lot of times when you're going to see, and it's already hard to understand a physician's handwriting already. So you're going to really have to become familiar and know those acronyms, because half the time he's not going to write out. It's going to be one little letter and he's going to scribble, but you're going to have to know how to read in that medical chart to diagnose what he's really saying. But then if you don't know, you go to that doctor and you ask that supervisor or nurse that's in there with that doctor. So the chapter topics: format, organ or disease-oriented panels, drug assay, therapeutic drug assays, evocative suppression testing, and we're not going to go through everything on here, but the most important parts for you all to know. Your objectives: explain the format of the pathology and laboratory section, understand the information in the pathology and laboratory guidelines, demonstrate an understanding of pathology and laboratory terminology, which is very important to know the terminology that's used in the pathology and laboratory section. Differentiate amongst the organ or disease-oriented panel codes, recognize drug assay codes. So this was one of your daily assignment questions in the beginning. The format of the pathology and laboratory section of the CPT manual is formatted according to type of test performed.
Yeah.
So the type of test performed is what is the format of the pathology and laboratory section. Automated, multi-channel, panels, assays, and so forth. To familiarize yourself with the content of the pathology and laboratory section, review the subsections in the CPT manual. For my new students, it takes like 7 to 10 days before you receive your manuals in the mail. They will be dropped to your door in the mail. That's your hardback CPT manual, your CPT manual coding book, your ICD-10 coding manual book, and your HCPCS coding manual books. Those will be delivered directly to your home, and it usually takes from 7 to 10 days before they arrive. In the meantime, until you get those books, please, you can use Google. We used to be able to give out coding formulas, but now they're asking for everybody to pay for them. So until you get your books, you can use Google to look up your codes. Laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility and imply that when a certain test is positive, it is assumed that the physician would want further information on the condition and specific additional tests performed. For example, if a routine urinalysis is performed, a culture is performed if the test is positive for bacteria. If a culture is performed to identify the organism, a sensitivity test is performed if the bacteria are of a certain type or count, or predetermined by the medical facility to warrant the additional laboratory test. All of this information, this is found in the pathology and laboratory section of your CPT manual. Most pathology and laboratory subsections contain notes. Whenever notes are available, be sure to read them before assigning codes from the subsection, because specific information pertinent to those codes is contained in these notes. So when you're looking up a code and they have notes, read those notes, because it might say, when you look at that code, see this, look for this. So always read the notes that's in front or behind that code. Make sure you read it, because if you just code straight from what you see, you might be coding the wrong information. Organ or disease-oriented panels. The codes in the organ or disease-oriented panel subsection. And so when you have your test for my newer students, look at the code range. So organ or disease-oriented panels, the code range is 80047 through 80081. So if you're looking for organ or disease-oriented panels and it's 80097, you know that you're in the wrong section. So always make sure that you look at the code range for what you're looking for. So it says the codes in the organ or disease-oriented panel subsection 80047 through 80081 are grouped according to the usual laboratory work ordered by a physician for the diagnosis of or screening for various diseases or conditions. Groups of tests may be performed together using automated equipment, depending on the situation or disease. For example, during the first obstetric visit, a mother is commonly asked to have baseline laboratory tests performed to ensure that appropriate antepartum care is provided. CPT code 80055 describes an obstetric panel that would typically be performed during the first obstetric visit. To assign a panel code, each test listed in the panel description must be performed. Additional tests are reported separately. So when they gave that example of a baby. So if they have panels, all of those that one test, so you wouldn't bill each additional test. You're going to bill that panel that they do on your first initial visit. Then it says additional tests are reported separately. So when you're looking at that chart to code, if you're in a special clinic, if you're in a gynecology clinic or whatever, they're going to have panels and it's going to be in that medical chart. And when that technician goes and do that blood work and when they send it in or whatever, they're going to code for those panels, that lab tech, for what they're using and what they're doing. You're going to look in that medical chart for what he ordered, and that's what you're going to code and build from. The development of panels saves the facility from having to report each test separately and is often more economical for the patient. You cannot assign modifier 52, reduce service with a panel. For example, if all of the tests in the obstetric panel were done except the syphilis test, you could not report 80055 obstetrical panel with modifier 52. You would instead list each of the tests separately. Always make sure you read your coding shots. Your coding shots give you very, very important information. It says, be careful when coding multiple panels on the same day for the same patient. Sometimes several panels include some of the same tests. So you have to make sure that when you're trying to code, that it's not the same test, but written further down in that panel. For example, a hepatitis B surface antigen test is included in both the obstetric panel and the acute hepatitis panel. It would be inappropriate to report the same test twice. So you don't want to get an audit, because a lot of times they're looking at that when it comes to certain panel, if you're trying to overbill a double bill. So you want to be careful when you're coding that you're making sure that that same test is not in another test that you're trying to bill for. That would be fraud, and they'll look at that. So be careful when you're doing certain tests. The laboratory and pathology reports in the patient medical record will describe the method by which the test was performed. There are many different methods of performing the same test. For example, a urinalysis can be automated or non-automated and can include or exclude microscopy. It is necessary to know these details if you are to assign the correct urinalysis code. If the details you need are not in the medical record, ask the laboratory staff or physician for further clarification. So as I was saying earlier, the lab technologists, that lab tech, they're going to be coding and billing for certain tests as well when they send it off to the lab. So in your medical record, when you're looking, it might be different, but you'll have to make sure that that lab technician didn't bill for something that you have in a panel. So that's very important to make sure that you always check when they send that paperwork in that you're not double billing. So I'm not going to do the codes because I know the newest students do not have their books, but we're going to skip to this. Number 2, organ or disease-oriented panels. How many laboratory tests must be included in a hepatic function panel?
Is it 10?
I'm sorry, I couldn't hear you.
So I was just guessing, looking at the number, I don't know if I had it right.
What did you say? I didn't hear you.
10?
It's not 10.
Or close by. 10, 11, 12.
Not
7.
5. It was in your note, the section prior. How many? Let me go back down. How many tests? How many laboratory tests must be included in a hepatic function panel?
7.
7.
Yeah, I see it.
Yes, 7. So let me tell you for the new students, whenever, like exercise 25-1, wherever you have your questions, it's never going to be past it. It's always going to be before. All of your answers, when you have the exercises, when they do it, it's going to be a review of what you have just read. So when you look at the information, just like this, hepatic function panel code in a patient with hepatitis B, serum virus, chronic, the CPT code. You know you're going to be in the range where we said the organ or disease-oriented panels. So when you're going to look in that CPT manual, you know that it's going to be in the range of 80047 through 80081. So you're going to stay in that range to find that code. You're not going to go over 81. If you're going over 81 and it's for organ or disease-oriented panels, you know that you're in the wrong section. So always remember when you're reading your Exercises, this is telling you it's organ or disease-oriented panels. So for anything you're looking in, is going to be prior to what you have just read. It's going to be in the information before the questions, your answers. And then when you're looking up the code, organ or disease-oriented panels, you know it's going to be through 80047 through 80081. So that should be able to help you. You know that that answer is going to be in that code range. Next, it says, does an obstetric panel include a rubella antibody test?
Yeah. Yes.
Yes, it does. That's in the information you read prior. Is blood type in ABO included in an obstetric panel?
Yes.
That is yes as well. And all of that information is in what we have just read. So that's why I say it's important to read your textbook, read the information. Those answers will be prior to you get to your exercise. So now I'm going to go to the PowerPoint slide so you can see how this works. So it has on here.
When I went on the when I went on the e-learning, the PowerPoint thing's not open.
It wasn't open for you?
No.
Okay, so I'll go back and check it.
All right, thank you.
Okay. And sometimes what's been happening, we've been having some technical little glitches. So when that happens, just send me a text message or email if it's not open. Yeah, but I'll go in and make sure it's open. So types of pathology and laboratory. These are the different types. It says subsections such as organ or disease-oriented panels, drug assay, therapeutic drug assays, evocative suppression testing, consultations. So these are types of pathology and laboratory tests. And then make sure you always look under the section, under the PowerPoint slide. It says the pathology and laboratory sections of the CPT manual is formatted according to types of tests performed. That was one of your daily assignments. So a lot of the information, if you read your PowerPoint slides, you'll be able to get those answers as well. Pathology and laboratory, codes for laboratory tests only. So in this section, it's codes for laboratory and test only. Specimen collection are coded separately. So if you're collecting a specimen, that's going to be coded separately. It won't be coded with laboratory tests. And so it says, example, venous blood draw reported 36415 in the surgery section. Medicare fee schedule each year identifies those lab tests associated with a physician component, and you would use modifier 26. Look at what it's saying at the bottom. It says, the services in the pathology and laboratory section include the laboratory test only. The collection of the specimen is coded separately from the analysis of the test. Per the example, if a patient had a clinic lab technician withdraw blood, means of venipuncture of the finger, and the sample was analyzed in the lab, use code 36415 for venipuncture, in addition to a code to report the test performed on the blood. Use G0001 for Medicare patients. So once you get into it, and when you have Medicare patients, they have different insurance carriers. So all of that will be in the medical chart, so you would know if it's a Medicare provider. But remember, codes for laboratory tests only, specimen collections are coded separately. Facility indicators allow additional tests without physician written order. So example, a urinalysis positive for bacteria, built-in indicator for culture. So this means that it would allow additional tests to be done if the test came back positive without a physician written order. It says laboratories have built-in indicators that allow additional tests to be performed without a written order from the physician. These standards are set by the medical facility. Indicators imply that if a test is found positive, it is assumed that the physician wants more information on the condition. If a routine urinalysis is performed, A culture is performed if the test is positive for bacteria. Pathology laboratory caution. So this means this is a caution that you have to look at. Usually report second or subsequent tests without modifier 51 multiple procedures. Rather report times. So you use this as times, like how many tests. The only CPT modifiers used in this sections are 90 and 91. So when you get your CPT manuals for my newer students, in the front cover of your CPT manual are all of your modifiers. As soon as you open the cover of that book, you're going to have every modifier that is used. And next to that modifier, it tells you what it's for. So you'll always know what the modifiers are for. The CPT manual lists the drugs most commonly tested for, although the use of code is not limited to the drug listed. The modifier 51 is not used with pathology or laboratory codes. Instead, each test is listed separately. Organ or disease-oriented panels is telling you the code range again. Groups of tests often ordered together. So in this code, they'll tell you what tests are usually ordered together. Basic metabolic panel, general health panel, electrolyte panel. Codes in this subsection are grouped according to the usual laboratory work ordered by the physician for the diagnosis of or screening for various diseases or conditions. Groups of tests may be performed together depending on the situation or disease. So this is what you should know, especially when it comes to that certification, the rules of the panels. All tests must have been conducted and be medically necessary. Do not use modifier 52 for reduced service. Additional tests over those in panel reported separately. If all tests in panel not performed, you're going to list each test separately. Do not use panel code. That can cause fraud. Because if it's in the panel, you don't need to list it separately. But if it's in a panel, you're going to bill it together. Problem-oriented in scope. All tests in the panel description must have been conducted if the coder is to go for the panel. So that's letting you know. It has to be listed in that description in order for the coder is to code for that panel. If the entire panel is not completed, you would code each test separately. Presumptive drug class screening. This is the code range. It's a very short code range. 8305 through 8307. Very short. Divided by methods. 3 different methods categories include optical observation is 8305. Instrument assisted, 8306. Instrument chemical analyzers, 8307. Identifies presence or absence of drug. Very simple. This little class here, you're only going to have 3 code ranges. And this is because it's going to identify presence or absence of drug. Drug screening is an analysis which identifies the presence or absence of a drug. Code this carefully. Understand that you can code the number of procedures performed, not the number of drugs being tested for. That's a big difference. You're going to code the number of procedures performed, not the number of drugs being tested. Which code is reported if screening is performed visually? So you see, if it was a visual screening, it's going to be 8305, optical observation. Optical means with your eyes. If you was an instrument assisted, it's 8306. If it was an instrument chemical analyzers, it's 8307. It's only those 3 that can be performed. Presumptive drug class screening. These are the same 3 ranges. Chromatography, procedure in which single or multiple drugs identified, reports chromography procedures, screenings is presumptive, and the report is 8307. The thin layer chromography drug screen is presumptive for single or multiple drug class performed method per date of service and reported with 8307. This does not identify amount of drug present, only present or absent, only if it was there, if a drug was in your analysis or not. So we're going to go over a couple of things that might be on a test, just a review of what we have discussed so far, giving you a little brief little summary so you'll know what to study and what to look for on your exam. Remember, the exam opens tomorrow, but you have until Sunday to complete it. And then we're going to go over a few more PowerPoint slides. So this is a true or false. And I told you to pay attention to your true or false, because a lot of times it might be one word that might make it false, one word that might make it true. Services in pathology laboratory are provided by a physician or by technologists under responsible supervision of a physician. Is that true or false? Services in pathology laboratory section are provided by a physician or by technologists under responsible supervision of a physician. Is that true or false?
Say it one more time.
Services in pathology laboratory sections are provided by a physician or by technologists under responsible supervision of a physician. True or false?
True.
That is true. Remember, if it's a technologist or whatever, a physician has to be supervising. A service that is rarely provided, unusual, variable, or new, may require a special report in determining medical appropriateness of the service. A service that is rarely provided, unusual, variable, or new, may require a special report in determining medical appropriateness of the service. True or false?
True.
That is true. When reporting organ or disease-oriented panels, if all but one of the tests within the panel is substantiated by the physician's documentation, it is acceptable to assign the code with modifier 52 to the code used to report the service. True or false?
False.
That is false, because why is it false?
Because you have to be able to code for all the tests in the panel.
Right, and you never report
The
modifier
modifier
52. Right. Pathologists have specific codes for clinical pathology consultations. True or false?
True.
Pathologists have specific codes for clinical pathology consultations. True or false?
True.
That is true. Next, for repeat laboratory tests performed on the same day, the correct modifier is 51.
That's false, huh?
That's false. We just went over that. That is false. Next. When coding chemistry tests, an analyze is measured in multiple specimens from different sources or in specimens that are obtained at different times. The analyze is reported separately for each source and for each specimen. True or false?
False.
I'll read it again. What did you say?
False.
No, that is not false. That is true.
Okay.
So listen to what it is. It says, when coding chemistry tests, an analyze is measured in multiple specimens from different sources or in specimens that are obtained at different times. The analyte is reported separately for each source and for each specimen. That is true.
Okay.
Next, therapeutic drug assays 80143 through 80299. The examination is quantitative. True or false?
Quantitation.
Therapeutic drug assays 80143 through 80299. The examination is quantitative. True or false?
False.
No, that is true.
See, I get that wrong.
Okay, so we're going to go through some more.
This is just, oh, Jesus.
So here we go. Look, it's going to be right here. So make sure that you read these PowerPoint slides. Therapeutic drug assays, 80143 through 80299. Reports present and amount, quantitative or absence of a substance. Material examined can be from any source. Drug listed by generic names. Example, antromethylene, generic name for brand name Elavil. PDR, a must for coding drug assays. Measures peak after drug given at intervals and troughs before drug given next dose. Used to monitor therapeutic drug for medication adjustment. Under the slide, it says, drug assays test to detect a specific drug and to quantify the amount of that drug that is present. What does quantitative information determine? It determines the presence of a drug. The exact amount present. A coder should have a drug reference. Example, Mosby's drug consult. You'll have this in a clinic if you're working in this department. They'll have that little card, little block and little slides. It's like a little index roller. They'll have that for you there. Handy to look up generic names of drugs that are listed by brand name. You'll have the drug manual and the medical documentation. Drugs in the CPT manual are listed by generic, not brand name. So remember that in your CPT manual, it's listed by generic names, not the brand name. Evocation suppression testing measures stimulating, evocative calling forth a response or suppressing agents. Codes report only TC of service. Remember, TC is the technical component. The testing is performed to measure the effects of stimulating, evocative, or suppressing agents on chemicals constituents. So it says, do you know which codes are used to report supplies and are drugs used in testing? Which code is used if the physician administers the agent? So we went over that in the last chapter. Can you all tell me, what do you use if it's supplies and are drugs?
That's the TC.
That is the TC. That's the technical component. And which code is used if the physician administers the agent?
That's 26.
But what is that? The initials?
That's what it says. It's the professional component.
Right, the professional component. So it says which code is used if the test involves prolonged attendance by the physician. What was that one, Jerry?
You said what's the code?
Which code is used if the test involved prolonged attendance by the physician? That was in our last chapter in 24. We're going to go back over that.
Wait,
so professional component was the doctor. TC is the technical component. That is the equipment and supplies. And the prolonged.
Is it the global one?
Yes. Global component. Yes. Evocation suppression testing, additional services to report, supplies and or drugs used in testing, 99070 and or HCPCS J codes. EM, what do my oldest, do you remember what EM stands for?
And I got it.
Evaluation and management.
Correct. And see, like I'm saying, they're not going to have this written out. You're going to have to know what those abbreviations, acronyms, medical terminology means. EM stands for evaluation and management for physician monitoring of testing. If the physician supplies the agent, use code 99070. If the physician administers the agent, refer to the code range 90760, 90761, but this will be in your manual for this section. If the test involves prolonged attendance by the physician, use appropriate EM code, which would be included in your global. Pathology clinical consultations. This is the code range, very short as well. 8503 to 8506. So this is clinical consultations. This is the only three little ranges you're going to go through. If it's at request of physician, additional information about specimen is going to be in this code range. Based on level of MDM or total time spent, it's in this code range. NDM determines if straightforward, 8503, moderate, 8504, or high, 8505. Determine if based on 2 of 3 MDM elements, the time, you're going to document total time spent by consultant for all activities on date of consultation, not including activities usually performed by clinical staff. And so it says, at the request of a primary care physician, a clinical pathologist may be requested to perform a consultation to offer additional medical interpretation. For that information, clinical consultations is in the code range of 8503 through 8506. More consultation codes. Surgical pathology, this is the code range. Used when pathologists either review slides, materials, or reports, provides consultation during surgery, reported on specimen, block, section, cytologic exam. Pathology terminology. You have to know what the terminology means. I can't stress enough, the doctor's not going to write out everything. It's going to be shorthand. You have to know those abbreviations, the terms, and everything else. Specimen, sample of tissue of suspect area. Block, so block, if you see, that means frozen piece of specimen. Section, slice of frozen block. So this is the terminology that's going to be used in the pathology section. Each section have their own use of terminology. So when you look in the pathology laboratory section, block is frozen piece of specimen, section, slice of frozen block. Example, pathologist consults during surgical procedure, examines one block. That's going to be 88331, examines each additional section of same block, 88332. Note that each specimen may be reported separately, but each slide from that specimen may not. When one block is sectioned and examined, the service of examining the first section is reported with the use of 88331. The second section, as well as subsequent sections of the same block, functions as an add-on code, but is not marked as an add-on code. Urinalysis. Urinalysis have a larger range, 81,000 to 81,099. Test on urine, method of test, example, tablet, region, or dipstick. Reason for test, an example is pregnancy. Constituents being tested for, example, bilirubin or glucose. It says, what are the 6 things for the coder to remember when he or she is coding urinalysis and chemistry subsection? So this definitely will be on your exam. What are the 6 things for the coder to remember when he or she is coding urinalysis and chemistry subsections? Number 1, the identification of specific tests. Number 2, whether the test is automated or non-automated. Number 3, the number of tests performed. Number 4, the identification of combination codes or similar types of tests. Number 5, whether the results are qualitative or quantitative. And number 6, the method of testing used. This is in your PowerPoint slides, so that's why it's so important for you all to read your PowerPoint slides. It shows you here, this is the same way, equipment used. When we went through it on the slides, automated or non-automated, with or without microscope, number of tests performed. That was the information under the slide. Chemistry, this is the code range for chemistry. Specific tests on any bodily substances, urine, blood, breath, feces. Most chemistry tests are quantitative, specific amount, unless specified qualitative. And it tells you codes for chemistry subsection. This is the code range. Chemistry tests are performed on any bodily substance. Codes are in alphabetical order in the CPT book. It asks you, what is the difference between quantitative and qualitative? Qualitative is the presence of, while quantitative is how much is present. So make sure you know the difference. Quantitative is the presence of, while quantitative, I'm saying over here, qualitative is the presence of, while quantitative is how much is present. So go through some more review questions for the exam. When a pathologist provides a consultation involving the examination and evaluation of a patient, the service is reported with 80503. True or false?
True.
No, that is false. It's not with 80503. So that's why, too, you have to make sure you know those code ranges. So I'm going to do a different one because I know all of you don't have your books. So I'm going to do some other ones. So during the evocative suppression testing, the correct codes for the physician's administration of the evocative or suppressive agents are reported during on the method of administration. True or false? I'm going to read it again. During the evocative suppression testing, the correct codes for the physician administration of the evocative or suppressive agents are reported depending on the method of administration. True or false? True or false? During the evocative suppression testing, the correct codes for the physician administration of the evocative or suppressive agents are reported depending on the method of administration. True or false? We went over that.
True.
That is true. How many levels of surgical pathology are there? A2, B3, C5, or D6?
Surgical pathology.
How many levels of surgical pathology are there? A2, B3, C5, or D6?
Is it 2?
Not 2, no.
Say it again. I mean, the numbers again.
Yeah. How many levels of surgical pathology are there? A2, B3, C5, or D6?
5.
It's not 5.
Surgical pathology.
It's
Surgical
6.
pathology.
6.
Oh, gotta be 6.
Yes, it's 6.
I have it. I'm just.
Next, what type of drug test measures the presence of a drug in the specimen? A, quantitative, B, qualitative, C, confirmatory, or D, immunoassay? What type of drug test measures the presence of a drug in the specimen? A, quantitative, B, qualitative, C, confirmatory, or D, immunoassay?
Qualitative.
B, qualitative. Yes. What is the name given to grouped laboratory work that represents those tests commonly performed together?
Panels?
Yeah. It's a panel.
Oh, I just he said that. I was scared.
That is it. Look, and I was going to give you, it's like, what is the name given to group laboratory work that represents those tests commonly performed together? I was going to go A, multiples, B, indicators, C, panels, or D, standing order. So that correct answer was panel. Next, in what section would you locate codes to report venipuncture and arterial punctures? A, surgery, B, EM, C, medicine, or D, pathology laboratory?
I think it's medicine. Is it medicine?
No, sir.
You just
Read
put
it
that
again.
up there, and I can't remember what it was.
Read
I
it
know.
again.
See, that's what I'm saying.
Read it again.
In what section would you locate codes to report venipunctures and arterial punctures? A, surgery, B, EM, C, medicine, or D, pathology laboratory?
EM.
No, ma'am.
It's a surgery.
Surgery, yes. I just had that up there. See what I'm saying?
I'm confused. I got all that. I'm still reading.
That's what I'm saying. I'm going over it and then I'm giving, and this stuff is on your exam. So this is telling you why you need to go back, read those PowerPoint slides, read what's in your chapter. Everything that's on your exams comes from the PowerPoint slides and in your chapter. Next one. In the pathology laboratory section of the CPT, drugs are listed by their blank names: brand, manufacturers, chemical, or generic. In the pathology, generic. I'm going to say, like, y'all should know that. We just went over that.
Because you said they're not with the brand name.
Right.
Yeah,
generic. Yes. A sample of tissue from a suspect area can be further divided into which of the following? A sample of tissue from a suspect area can be further divided into which of the following? A, specimen, block, section. B, block, section. C, sample, block, section. Or D, specimen, section. Repeat it again. A sample of tissue from a suspect area can be further divided into which of the following? A, specimen, block, section. B, block, section. C, sample, block, section. Or D, specimen, section.
Sample, block, section. B.
That is correct. B, block, section. Next, qualitative analysis is defined as A, determining the amounts and proportions of chemical constituents. B, analysis of a substance in order to ascertain the nature of chemical constituents. Which one, A or B? Qualitative analysis is defined as A, determining the amounts and proportions of chemical constituents, or B, analysis of a substance in order to ascertain the nature of chemical constituents. A or B?
B.
B is correct.
That's the one with the L.
And see, right, that's the stuff, that's what you have to do.
The one
you
without the L is the
something that's going to help you remember. That is right. Very good. Next, codes in the everybody should get this one. Codes in the pathology laboratory section. Evocation suppression testing include which of the following? A, complete service. B, test, injection, substance administered, physician's time. C, injection and substance administered, or D, test only. Not everybody at one time.
Test only?
Test only. The beginning, this was your daily assignment question. What?
I got it. I got the
That's
test.
right.
Yeah.
That is right.
Yeah, it's different. Yeah, different things.
Yes. Next. The blank panel consists of a CBC, hepatitis B, rubella, syphilis test, antibody screen, and blood typing ABO and RH. A, general health. B, obstetric. C, lipid, or D, acute hepatitis.
Obstetric.
Correct. B, Jerry, you say you came back with that one, huh? B, obstetric. That is correct. So that is all for our review. So guess what? Y'all have to go back and read those PowerPoint slides.
Yes.
And see how important it is to pay attention and to be listening and jotting down and highlighting in your book or whatever you need to do so you can remember, because everything that I've gone over is on your exam. Everything. And majority of that information we went over, it's in your PowerPoint slides, and it's on and in your section of your chapter 25, pathology and laboratory. So we stopped at chemistry. And so you see, we only have a few more slides to actually cover that you all can go over, because we're going to finish the rest of them, and not even all of them, on Thursday for our 4 p.m. class. And remember, if you're unable to attend, let me stop sharing. If you're unable to attend, this is being recorded. I will be sending it out to each and every one of you so that you can go back and review some of the questions that I've asked, because they will be on your exam. So just go back and review. This here class was 10 points, so you make sure that you're keeping account of your points. So please write down how many points you received for this lecture class. This lecture class is 10 points, and it's for everybody that's in this class. You still will be able to go back and look at it if you're not on, but you won't receive the points. This class, I'm about to take the picture of it now so that I can make sure, but you're responsible for keeping account of your, you're responsible for keeping account of how many points you earn. So if at the end, and if you might be short on an assignment, or you might score lower on your exam than you expected, you can text me, email, or give me a call and say, well, I have 50 points. Let me apply 10 here. If you made a 60 and you want to add your points here, or you have an assignment that's missing, or you made a B on assignment, you want to add it to get 100. So you can use the points, in any way that you feel you would want to. So please just make sure that you keep a tally of your points on your own. And then when you're ready to cash them in for any, like I said, lab, daily assignment, or exam to add to an existing assignment that you might not have done as well, please let me know, and then I'll add those points to that assignment. So remember, if you need assignments reopened, it's only going to be for the week that assignment was done. So say that you missed Monday's assignment. You have this week to let me know. I am no longer going back 2 and 3 weeks to reopen assignment. It is getting too time consuming. Then I have people saying that, my assignment wasn't great. Like I said, this is not my only class. I have other classes that I have to grade and teach as well. And I have to, answer to assignments. I'm doing tutoring with other students who are having difficulty. So please just, have patience. All of the assignments from last week have been graded. All of the labs and exams have been graded. But remember, I do have other classes that I have to grade and do as well. I have to do all of the exams as well. So just, be patient and keep that in mind. If you feel that your grade was corrected in error, please let me know and I will go back and look at it and change it if it was my mistake. I am human. I do make mistakes, but let me know so that I can go and update or change the grade. So do we have any questions or concerns right now? Anything that you all would like to ask in reference to your assignments? If you need labs or daily assignments reopened, remember, read your emails. Please read your emails. Please go back and look at this recorded video. It is being recorded, but read your emails when I'm sending out emails. I'm getting a lot of people, calling and asking me things that I said in the lecture. So that's letting me know that you're not watching the lectures and that you're not going back and reviewing your PowerPoint slides. Jared, I will go and make sure that I reopen the PowerPoint slides. So in the grade section of e-learning, you will have your syllabus to look at all the objectives we're covering, and you will have, it's going to say Zoom class in that grade section of e-learning and PowerPoint slides. So you can click on in the grade section of e-learning PowerPoint slides and you're able to get your PowerPoints. Any questions or concerns?
No, ma'am.
Nobody has anything to say?
Oh no.
You could use y'all could use y'all bonus points for that first assignment that somebody said that they wasn't opening back up.
Jerry, don't be funny. See, that's why I knew I should have stayed off today. I knew I should have stayed off.
Wait.
That's okay though. I'm getting my grades up. I'm getting them up. I'm getting them up though.
Guess what, Jared? The new students are not responsible for that day one, so they don't have to worry about that.
They didn't start. Man, he's trying to be friendly towards me.
Wait, I didn't get it either. I missed the
first
assignment too.
Jared?
He missed it, Tyra. He missed it, Tyra. Because guess what? He didn't read those emails or whatever happened.
No, I read the emails. I was sick that Friday. No, I was sick that Friday. So I didn't even get on the computer.
Story then, Jared, if you were sick.
Yeah, I was sick that Friday. But when you said you wasn't opening back up, I just cashed in my points. I wasn't even going to do it.
No, Jared, I wouldn't do you like that. If you were sick, that's a different story. If you're sick, then that's another story. Then just not doing it and not reading the emails. Because
I was sick too then. I'm
still sick. So what's gonna happen now though is because I'm just sending emails for like my dear poor little heart, just sending emails, and then people are calling me and asking me the same thing that I had sent in the email. No. You have to read your emails. You're not going to be able to do that on a job. You will get terminated. If you don't complete your assignments, they're giving you stuff to do, they will fire you. So we have to treat this like it's a career. This is a very lucrative position and career to have. Medical billing and coding is in high demand. I mean, if you look there, it's in high demand. So you have to take this serious. This is your education. And this is a very lucrative job. You can make a good salary, a good living with medical billing and coding. So we have to really take it seriously and not lag along. I know life happens. Things happen. Things come up. I understand all of that. But it can't be the same people every time, every week, saying can I reopen assignments? No. We have to be accountable. We are all adults. None of us are children. We are adults. So we have to be accountable for ourselves. And like I said, this is your career. So take it seriously. And like I said, I am human. I do understand we have things that come up. We get sick. We have families, children, things happen. So I don't have a problem with reopening assignments, but I'm not going back and today you ask me to reopen, and then 2 weeks later, you asking me to reopen it again, and then you didn't complete it when I've given you an extra week. No, you have to take this seriously, but I will reopen assignments if need be during that week. And if it's something that's more serious or something has happened, communicate with me and I will reopen, but you have to communicate. I'm not just going to be reopening assignments just because on a job, you have to communicate. You know, you say we have not because we ask not. So you have to communicate. So any other question? Let me get another people. I see some people joined in at the end. So remember, write down your points. Any other questions, let me know. I am glad and I'm here to help. And if not, I will see you all on Thursday. Remember, the exam will open tomorrow morning. This is being recorded. I will be sending this out later on tonight. I have another assignment that I need to do right now, so I'll be sending this out later. But remember, your exam will open in the morning, but you have until Sunday to complete your exam. But go through your PowerPoint slides and we will finish the other section on Thursday for 4 p.m. Enjoy your night. Enjoy your evening. Stay safe. I'll see you all on Thursday. Good night.
Good night.
Good night.